Hello, and welcome to another edition of the What is Global Health podcast. The topic for today will be the GoViral Study. The GoViral Study is a community participatory research study that was initiated in 2013. It aims to map, monitor, and measure the spread of acute respiratory infections within and across communities using a novel participatory disease surveillance strategy. Their strategy entails having community members sign up for the study online, request a kit, and then self-collect a fluid specimen whenever they fall sick. The study participants can send their kits to a lab where they perform a PCR respiratory assay to assess which viruses are present in the specimens. The ability to monitor the spread of these infections in the community is a novel and potentially revolutionary approach to disease surveillance because there's not much community data on this. The study allows us to gain a more comprehensive understanding of disease burden outside of data that is limited or confined to clinical data. Given their recent success, they are also planning on expanding GoViral to at least 2 other cities, Rio de Janeiro in Brazil and Istanbul in Turkey. Today, we are lucky to be joined by Professor Rumi Chunara, who is the principal investigator for this study and is based at the NYU College of Global Health and NYU Tandon School of Engineering, as well as Sofia Ahsanuddin, a research associate at NYU Tandon School of Engineering. They will tell us more about their fascinating study. Thank you so much for joining us today.
Hi, Ricardo.
Hi, how are you?
Good. It's nice to speak with you.
Yes, it is.
This is Rumi, and so
Hi, Ricardo. This is Sofia.
Hi, nice to, not meet you, but speak to you.
Yeah, I know. It would have been great if we could meet in person, but this is equally fine. And thank you so much for your responsiveness and your enthusiasm to learn about GoViral.
No, of course. I think it's a great project, and I'm excited to make a podcast about it. So unless you guys have any questions, we can start. You tell us more about what the GoViral Study platform is and what you've done with it so far.
Okay, great. So the GoViral study, it's one of the projects in our group, and just to give a little bit of context, our research group looks at new data sources to better understand population-level public health. And so one of these topics that's of great interest is influenza and acute respiratory infections because, of course, they happen every year. They affect a lot of people, and even if we don't have severe enough illness to go into a physician, we still get affected by it, have to stay home from work or miss school. And this means that a lot of information about who gets sick is not actually being captured by regular hospitals and physician-type systems. So it's a great place for us to harness kind of internet and mobile connectivity and working right with the community. So GoViral is a community-based study in which we ask members of the community to tell us how they're feeling about what types of symptoms they have on a weekly basis. Very simple list of symptoms, things like fever, cough, runny nose, sore throat, things that might indicate you have a cold or a flu. And for anyone who's signed up, we also in the mail send them a little flu specimen collection kit. So if you do get sick, you do an easy-to-collect nasal swab from your own home and just mail it back to us. And that way we're able to see not just how people are feeling, but also what types of viruses are going around in our city.
And was it easy to get members of the community to cooperate? Did you have a very expansive participation rate?
Yeah, so we have been running the study for a couple of years, and what we found is that it's very easy for people to do once they've signed up. They report that it doesn't take very long, and they don't have any major challenges with, telling us how they feel or even collecting their specimen at home. Even when people are sick, they manage to do it, which was a good result for us. Definitely a challenge is getting more people involved because the more people involved, it means the better our results are. We have more data, and we can conclude with better significance. So we try and really work with the communities in different ways to just increase awareness, and hopefully participation also helps people understand a little bit more about getting infections and viruses and public health.
And like you said, the GoViral platform allows you to access a populational group that was previously ignored because when you have a mild flu or mild influenza, you wouldn't go to a physician. So having this platform, how has that allowed you to make discoveries that were previously unknown? What new things have you discovered so far?
Yeah, that's a great question. You're right, exactly. We found that about 80% of people consistently year to year who do get sick and send us a specimen don't go in to see a doctor or go to a hospital. So most of the data we're collecting is not being captured any other way. So this means we can look at things like what proportion of viruses are happening just in the city. And if you go to our website, you can see a nice visualization of what we've found so far. So what proportion of viruses in the community were coronavirus or rhinovirus or influenza. And that kind of measurement hasn't happened across the city in the same way. Mm-hmm. We can also, because we're collecting data from individuals, we can link what kinds of symptoms or demographics are related to the different viruses. So we can start looking at kind of how those things might synergize or risk groups that, again, we wouldn't be able to tell otherwise.
Mm-hmm. And to add on to what Rumi said, GoViral was initiated back in 2013, but since it was first initiated, we found that 53.5% of people tested positive for a virus. And again, if you go to our website, you'll be able to see the distribution of these viruses according to zip code. And one of the objectives of the study is to try to visualize the data on a spatio-temporal map.
That's amazing. And it's also amazing how you were able to apply technology that was not necessarily used for medicine to tap into a group of people that might not have access to medicine or to information that medicine itself doesn't have access to. What do you think is the role of such platforms and such technology in the realm of global health and in fighting not only the spread of viruses, like you said, but in developing an approach to medicine that's maybe more personalized and directly accessible by the general public?
Yeah, definitely there's many ways this can actually help us in kind of improving public health on a personal level and beyond. One of them is just kind of in terms of garnering that data, right? Like we already talked about how we can get data that's links virus types to the phenotype or a lot of type of information that perhaps was more disparate or not all collected together earlier. We can reach more people, maybe those cases that didn't get reported to hospital or weren't possible to get there. And then also one nice thing, and we've kind of learned anecdotally from our participants, is that they do like to participate. It helps feeling like you're participating in the community, kind of doing your part in public health. And so just by doing something on your own in your home, hopefully it can help people raise awareness about public health topics such as viruses, vaccination, infection, and the importance of our own behaviors on what happens in the population and disease spread.
That is a very interesting point because lately we've seen a very large gap between the scientific and medical community and the general public, leading to such controversies as, for example, the measles outbreak in California, when members of the community don't really trust doctors telling them that vaccines work. Do you think that platforms such as these, that, like you said, target participants in a very personal level and in a very accessible way, are ways that science can become more democratic and more accessible to the general public and maybe more marginalized communities?
Oh, certainly. I mean, I think, parsing through data that's available on the internet or through mobile sources offers a more democratized and accessible means of communication between physicians and public health professionals and the community members. It's a way of crowdsourcing health data and making the public health campaigns much more understandable and relatable.
You said you were very well received by the community, but did you receive any resistance from the scientific and the medical community in the sense that because this is crowdsourced, maybe there were issues about the credibility and the participation and the assiduity of participants? Were your results well received in the scientific community?
Yes. Because we use gold standard laboratory methods to process all the specimens, that provides some confidence in terms of what we're actually measuring. I think from the scientific hat and what would be the commentary from that side has been, we are aware of it as well, that we want to make sure, how do we interpret the data that we receive, right? Because if, for example, someone doesn't send in a specimen, it may be because they were sick or maybe because they just forgot to use the kit. And so we also have to be very careful in understanding what our data represents, and that way we can make more inferences from it. And we're learning about that through surveys, qualitative information with our participants, and that hopefully we'll be able to close the loop on everything there.
Very interesting. On the note of, like you said, GoViral being so able to reach out to the community, you have recent plans to expand to other cities like Rio de Janeiro and Istanbul. Could you speak more about those plans?
So we recently partnered up with the Metasub International Consortium at Weill Cornell Medicine to really capture what's going on in our cities and within the people living in those cities. So Metasub is completely dedicated to mapping the urban genome, or mapping the microbiome of the urban built environment. GoViral, on the other hand, is while our primary objective is mapping the spread of acute respiratory infections like the flu within these urban environments. So this past summer, we were planning on expanding to Rio de Janeiro and Istanbul, because these were two cities within Metasub that consented to start up GoViral in their respective cities. And it's really quite interesting in terms of the research questions that we can delve into in those cities. For Istanbul, the professor that we're working with over there is very interested, has a lot of experience with exploring antimicrobial resistance markers in clinical data, and he wants to explore that in the community data, which correlates perfectly with the work that we're doing in GoViral. And Rio, they're interested in looking at Zika virus and how they can capture it within the community members as well as in the environment, like the physical environment around them.
And even though you're working with different research questions, do you foresee any other issues that GoViral might face when they're dealing with a different community, maybe a different culture, a population that doesn't have the same scientific upbringing or access to technology as residents in an American city would have?
Yeah, that's a great concept to be cognizant of, and I think consistently a large part of our effort, it's scientific, it's public health motivated, but because of the sheer nature of it, working with people in the community, education is a very strong component, and we're obligated to inform our people who participate and let them know what's happening, and also use that as an opportunity to educate. And so I think doing that in a manner that's sensitive to different communities and what their needs are will be key as we start working with different groups.
And one of the challenges, I think, of conducting a study of this nature is basically capturing a representative and more diverse sample. Here in New York, in previous seasons, there was a disproportionate number of white participants. And this season, we want to diversify our sample so that there are more minorities present, there are more African Americans, Hispanics, Asian Americans who are represented in this sample. So we expect and anticipate that a similar challenge will be faced when we expand to these other sites. And like you mentioned, access to knowledge and access to public health data may be a concern, but education and outreach is a very big part of the study.
And what are the concrete steps that the platform is taking to, like you said, access these more marginalized communities that previously didn't have such a high participation rate? Because, like you said, it requires a scientific literacy, maybe access to technology, a sense of a community-based approach as well. So are there any concrete steps that you found were effective in getting these people that previously weren't participating to participate more?
Well, we're actually spearheading a number of different outreach efforts. So one of the strategies that we've come up with that we're finding is effective is reaching out to college campuses like the City University of New York, where there is a very large and diverse population attending these college campuses. We've also found reaching out to podcasts and a number of different news sources that we also found that to be quite effective as well.
Yes, great. And do you think that by accessing such a large amount of people, that there's a second benefit, not only in collecting more information, but raising awareness of the participants themselves about the spread of diseases, certain health risks, and certain cautions that they should take to prevent the spread of diseases? Do you think GoViral also functions as a platform to disseminate information surrounding global health and not only collecting it?
Oh, certainly. Like on our Facebook and our Twitter pages, we regularly post updates about about epidemiology or public health, and sometimes we'll post articles about Zika virus. And one of our side objectives is to improve literacy in the community about these various public health initiatives so that people don't feel frightened or scared of anything that's related to their own health and their community's health.
Wonderful. And what do you think that your experience working with this platform that has been very successful in employing technology and different tactics to produce such a wonderful result, what do you think this says about the future of global health in general, and how technology and community-based approaches can be pursued, not only to develop better science, but also to eventually deliver better health care to specific communities?
It's a great thought to be cognizant of, and I think we've kind of shown that there are specific parts about health for the population and the individual that we can improve on our how we understand them using new technologies, as well as increasing scientific literacy in the community and bridging that potential divide between scientists and the community. So given that technology, different types and tools and accessibility is increasing at such a rapid rate, I think we'll probably see a lot of parallels in other areas, specifically in health, to also further improve these initial steps in the near future.
Great. That's a very exciting moment in science to be a part of. And if any of our listeners are interested in participating in this study, what steps should they take in order to help collect information for the GoViral studies?
Well, I think if anyone is interested in participating in the study, they should come and visit our website, www.goviralstudy.com, and they should automatically sign up. It's a very easy sign-up process,
we also have an iPhone app. Just wanted to add that in. So it's GoViral Study for iPhone right now, and we're working on one for Android. Shall I just add in a little bit of the process? If you sign up for our study in the New York City area, you can request a kit. So you keep that at home with you in your dorm room or home. And if you ever get sick during the season, you can use it. And you'll also be gently reminded by us to just asking how you feel with some 30-second symptom surveys. So that's basically what's involved in participating.
And we're also, for this season, we're only focusing, here in New York City at least, we're only focusing on, generating specimens from the New York City region. We get specimen kit requests from all over the United States, but unfortunately we can't send kits out to them because we want to create a comparison between some of the clinical data that we're working on with Jeff Shaman's group at Columbia University.
Great. Thank you so much. Hopefully we'll have a lot more participants soon.
I think it was a great set of questions.
Yeah,
Great.
Thank you.
Of course. Thank you so much for your time, and thank you so much for your wonderful work.
Thank you so much.
Okay.
Bye.
You too. Bye, Ricardo.